In this episode, I'm going to explain what a Med3 Fit Note is, in what situations you may need one and when you may not, and also how you can go about getting one from either your GP practice team or hospital team for your ease. Let's take enhance your primary care and learning. So first, let's cover what a Med3 Fit Note is. What many people call a sick note or fit note is actually called a medical certificate of fitness that is used when people are unwell and need support to keep working, or time away from work, and entitles you to statutory sick pay. When you're unwell and needing time away from work, for the first 7 days that you are unwell, you do not need a fit note. Instead, you would use what's called a self-certification form, or SC2 as the form is called, which you can get either from the gov.uk website or from your employer. If you're unwell for more than 7 days or not able to work normally, then at that point you will need a fit note from either your practice team or hospital team. For a lot of people, this may be through your GP practice team, and this can now be issued either by your doctor or by a trained nurse, pharmacist or physiotherapist. Most practices will have different ways of managing this, and this can be either through online consultation, telephone consultation, video consultation, or a face-to-face consultation as well. If this is for a continuation of an existing fit note, do inquire at the practice, because that may not need to be a face-to-face consultation and can be dealt with much easier through other routes. If you need a fit note for your work, this will normally be done through a consultation with a trained clinician, and as part of that consultation they will advise you whether or not you need to stay off work completely, or if you may be fit to work with some changes, such as adaptations at work, working different hours, a phased return back to work, or changes to the actual duties that you may have. This is often termed as a maybe fit note, although it is the same form. And it's important to note, if your employer can't make those changes as recommended, then the note automatically becomes a note that says you are unfit to work. You don't need another form to say that. Most Med3 Fit Notes nowadays are provided as an electronic form that will come from your practice team that you can then send on to your employer or job centre as appropriate. Do check out the other video we've got that shows you how to do that. If you are unemployed and unable to seek work because of your health reasons, then a Med3 Fit Note may help to provide you time away from work finding roles, but also supporting you in terms of getting back into the work finding aspect, or accessing other support groups that are in that system, including Employment Support Allowance or Universal Credit, as well as specific groups set up through the Job Centre to help people get back into the working world. It's important to note that if you are asked by the Job Centre to get a note, then this is an actual medical assessment that needs to happen, and the clinician will work with you to figure out the best options available to you, and fit notes are not given on the instruction of somebody else. Getting a fit note from the hospital team. If you've been admitted to hospital or had a planned procedure such as an operation that requires you to take time away from work for more than 7 days, or that will impact your ability to work for more than 7 days, then you should get the Med3 Fit Note from your hospital team for the appropriate time to help your recovery. Not just 2 weeks. It is part of their responsibility of care to you as a patient to provide this. If you are directed to go back to your GP practice team to get a fit note, then this may be declined appropriately and unfortunately may delay your care or cause you more frustration. So do make sure you get that fit note from the hospital team at that point. Remember, this is only applicable if you are likely to be off or impacted at work for more than 7 days. Before we cover more information about the Med3 Fit Notes, if you have found this episode useful so far, please leave a like down below, share it with other people that you know, and comment if you've learned something new. When do you not need a fit note? You do not need a fit note if you have not been unwell for more than 7 days, you are not claiming statutory sick pay, to exempt you from going to things like school, university, or court appearances, to claim on insurance policies or housing benefits or other kind of benefits, or from compassionate leave from bereavements, or if you're needing to act as a carer for somebody else or go abroad. For these reasons, a Med3 Fit Note may not be appropriate, and you may be directed to other types of certification. Common questions about Med3 Fit Notes. If you've been given a Med3 Fit Note and you have multiple jobs, you will need to provide a copy of that to each of your employers. This does not mean that you get multiple copies from your practice or hospital team. Use the same copy and provide that on. If that's a physical copy, then you need to give it to one employer, ask them to make a copy, take it back and give it to the next one. Normally recommended to also keep a copy for yourself, particularly if you're engaging with the job centre, just in case things go missing. It's also important to note there is no such thing as a return to work note. Once the Med3 Fit Note has expired, you are able to go back to work, and in some cases even go back sooner if you are able to do so. However, there is no such thing as a return to work note, so if your employer is asking for that, that will be declined by the practice team. There are some small exceptions to that, such as HGV drivers who have been certified unfit to drive, but for the majority, there is no such thing as a return to work note. For any other questions that you may have about the Med3 Fit Note, check out the link here or that's down in the description that takes you to the gov.uk website that has all this information for you. Alternatively, if you have been sent a Med3 Fit Note and want to know how to send that on to your employer or job centre, check out this video right here that shows you exactly how to do that.